when there are fewer ways for the state to generate the state share, the non-federal share, and when there are fewer ways to pay providers, that's when states start making really hard decisions. Like, for example, I think I didn't cover this bullet point. In every Medicaid program, there's mandatory populations and optional populations, and mandatory services and optional services. The mandatory populations and the mandatory services, you have to play ball there. If you don't cover those, you don't get the federal money. You don't get the federal match. You can choose then to put optional services and optional people on your program, and you still get the federal match. Since this law was created in 1965, guess what an optional service is? Prescription drugs are optional. You don't have to cover them to have a compliant Medicaid program. Mental health and substance use disorder services are optional services. They are not required. You can still draw down federal match and not cover them and not offer them. So what I would say to you is, there are things coming, choices that the state will have to make, and it will be forced to confront ideas like, can you provide health insurance in which prescription drugs are not covered?